It's quite possible you're highly contagious. Don't talk to anyone. Don't touch anyone.
We're working very hard to find out where this virus came from. It's in schools and it's in the mall.
Have you found any treatment at all?
No.
It's going to spread.
It gets on airplanes. It travels at 500 miles an hour.
We're all guinea pigs.
Oh my God.
So that was just a trailer for the movie Contagion, and it's a nice intro to this week's talk on infectious disease. So diarrheal disease is a huge concern worldwide because it's the second leading cause of child death. It's second only to pneumonia, and diarrheal disease is fatal not only through direct malnutrition, but also by causing infections such as pneumonia that then result in fatality. And these deaths would be reported as deaths due to pneumonia, not due to diarrheal disease. Therefore, the number of deaths due to diarrheal disease is probably underestimated. So since diarrheal disease was the second leading cause of death in children, it was really important when working towards the Millennium Development Goals, which sought to reduce child mortality by 2/3 by the year 2015. Although a lot of advancements were made, lots of work still needs to be done, and we're now in 2015 and those goals were not reached. As I mentioned last week, infectious diseases typically impact low and middle income countries, since high income countries typically have the health infrastructure in place to prevent the spread of disease. The most common strain of tuberculosis, or TB for example, is completely treatable with a course of antibiotics. In high income countries with ready access to these antibiotics, adherence is not typically an issue. In low income countries, however, there are a number of structural barriers that make antibiotics inaccessible and can lead to the spread of disease and antibiotic-resistant strains. There's also a really interesting documentary, also happens to be called Contagion, and it's about multi-drug resistant and totally drug resistant strains of TB that are spreading in India today. And it's really interesting because it talks about how some of the health infrastructure that's lacking has led to the development of multi-drug resistant and totally drug resistant TB, and how the lack of adherence to medication has resulted in this spread of disease in the Indian population. So if you're interested, it's a really cool documentary, and there's a link that I'll post in the description below. So Dr. Pernica also talked very briefly about HIV/AIDS, which has shifted to being considered more of a chronic illness in high-income countries. With treatment using antiretrovirals and prevention during childbirth and through harm reduction programs, HIV has been managed fairly well in Canada. That said, it took a long time for us to get to where we are today. I think the stigma associated with the LGBT community really slowed research funding, and policymakers were very slow to implement policies focusing on treatment and prevention of HIV. With close to 100% mortality rate, HIV had a huge impact on the landscape of healthcare in Canada during the 1980s and the 1990s, and throughout the world as well. I think it's important to not forget the impact that HIV had on our healthcare system here in Canada, because it's still a huge problem in low and middle income countries today, especially in sub-Saharan Africa, where antiretrovirals may be less available, and concurrent infections can further compromise patients' immune systems. So hopefully now you're beginning to see that the treatment and prevention of infectious disease is a whole lot more complex than it might seem at first. It's a lot more complicated than simply prescribing a medication, as demonstrated in the case of totally drug-resistant strains of TB emerging in India. For treatment of diarrhea, for example, antimicrobials can help, but if water sources are continuing to be contaminated due to open defecation, children will continue to get sick and die from diarrheal disease. I think ultimately, treatment and prevention will require collaboration from multiple sectors. The health sector will need to work to improve access to drugs such as antiretrovirals and antibiotics, while also striving to increase compliance. Research should focus on diagnosis, since easier diagnostic measures can be carried out in a lower resource context. Concurrently, governments, industry, and NGOs need to work collaboratively towards water sanitation infrastructure in order to improve access to clean water. This collaboration between multiple sectors will not only address the short-term treatment of disease, but will also work on the prevention of infectious disease. So once again, there won't be a lecture next week because of Reading Week, but stay tuned for 2 weeks from now when we'll be discussing neglected disease following a talk by Dr. Martha Fulford.